Well, next topic.
Well, I think this topic is maybe one that hits a little bit more positive. It is one about money. You know, it is the allocations from the federal government to come back to us and allocate money to our local jurisdictions. We receive money as a city and a county. So under the American Rescue Plan, if we can get that presentation put up. I think Kathleen had to relocate for some technical issues, but we're getting that. We'll have that presentation up in a minute. Kathleen? All right. While she's doing that, I'm just going to talk a little bit about the agenda for what we're doing with that. So in our last meeting, when we talked about the ARPA, the American Rescue Plan Act money, Commission offered several comments to us. We listened to those. We have some of those laid out tonight. We think that's put us in a position to really kind of have some suggestions for guiding principles that we can work through. And we also will kind of run through what other entities have received as far as, you know, not just us, but some of the other jurisdictions within Wyandotte County received as far as money that's come in. I'm going to talk about, or I'll have Kathleen, we'll talk about our city funding requirements for Kansas City, Kansas. So we're going to break this out between Kansas City, Kansas and Wyandotte County. So you've heard these numbers come out and they're $87 million. Well, that's a lump money we did get as unified government, but it has to be expended within the correct part, as you know it. We are a unified government, but we operate the two independent agencies from a financial perspective. So some money can go to the county, some can go to the city, and we want to explain that to you. So we'll talk about where we can go for non-revenue replacement eligible uses, those that can go to take care of some of our immediate needs, and then those are for fund replacement. And then prioritization beyond our immediate needs and talking about that. And then also I want to just show some of our, and then we have a bunch of follow-up slides that are there that we're not going to go through, but there were questions you all asked. You said, can we add a fifth category for 2020? We built that into it, and there's all those. So I think you have all the presentations come to it. So Kathleen, are you able to get the presentation up? I think I've gone through your agenda in full detail, so I think you can move on to the comments from July 1 and start to walk through that.
So, yes, thank you. So during the, during the July 1st budget workshop, and we took down notes of all your comments, and and then I listened to the meeting again, and I have included many of them. Now, so the thought behind this is that these are expressions of the areas that you felt were a priority, and it's only for that respective meeting, because I know there are a few items that you talked about in previous meetings that are not listed here. So generally speaking, I'm just going to go over this. First off, you talked about public health and human services, including wraparound services. You talked about addressing deferred maintenance of facilities. So at least those facilities we plan to retain after we assess our the conditions of all our buildings and the needs for them. You expressed stormwater investments to keep our future rates low. You addressed disparities in our healthcare and housing, which is very in line with the objectives of the American Rescue Plan. You expressed broadband expansion to underserved areas, infrastructure for roads, bridges, and sidewalks, premium pay for employees fighting COVID, violence, substance abuse, and mental health interventions, also all areas that are covered by COVID or by the ARPA. Redevelopment of vacant areas in our neighborhoods, coordination with other entities in order to avoid duplication. You encouraged us to engage with community partners and to leverage funds. And then finally, to spend wisely and wait, maybe hold on to the funds and earn some interest. So those are some of the ideas that you came up with. And So this isn't a finite list, but we're open to listening to more ideas and more themes. So as we move through this process. And by the way, we're going to be talking about this process in this presentation as well. So the other areas that I gained from the meeting last time is that you have there's some suggested guidelines or principles. So we want to target goals. We want to target our ARPA funding to support the unified government goals or strategic goals. And we want to center our decision-making on core values of equity, diversity, engagement, and excellence. Those are certainly areas that are encouraged by the federal legislation. You want to do strategic investments to potentially lower future financing, the mill levies, or diminish the mill levy reliance, or diminish fee increases. And you want to leverage existing infrastructure. My things here. Leverage existing infrastructure efforts, avoid duplication of other grants, maximize all ARPA funding by first cross-mapping across more restrictive funding. Of course, we want to use best practices, kind of learn from the administration that we undertook with the CARES Act. We want to learn from that and expound upon it. Maintain flexibility to reallocate funding as needs and if other federal guidelines evolve. And so some of that has to do with some of your questions about, well, what if we choose to fund a certain expense with the ARPA money, and then we get this other grant that could pay for that same thing. So certainly we want to make sure that our procurement guidelines are broad enough that it covers a range of grant opportunities, and then be very mindful that sometimes we can shift the funding source if we haven't engaged in the project, too much, or if we haven't really started the project. So keep that in mind. We're keeping all of our options open and being flexible. And then the last one is to use one-time funds for one-time uses, or at least find a path for sustainability after the ARPA funds are out, they're gone. One of the things that you asked me to do was take a look at what other entities in Wyandotte County have been collecting. And so we put this together. So the city of Bonner Springs, we have 3 cities in Wyandotte County. Bonner Springs received 1.2 million, Edwardsville 0.68, and Lake Quivira 0.1 or 140,000. The equivalent of ARPA for school districts is called ESER 3, and Kansas City, Kansas School District received an ESER 3 $82 million. Turner 9.4 million, Bonner Springs almost 4, and then Piper 940,000. And then the community colleges in our area, KCK Community College received 11.8, and Donnelly College 8 or 1.1. At the in one of the informational slides towards the back, it also shows what all the other metro cities in Kansas received, as well as Jackson County and Johnson County, just for your information. I can't wait to find out. Can you go back, please? Yeah.
I want a full explanation in writing of how come one school district gets 82 million and we get 940,000. So you don't have to give it to me tonight, but that is unbelievable what we're not getting.
Well, that was distributed by the federal
Like
government.
I said, what I want is an explanation in writing to verify what you're saying.
Okay. Well, be happy to. So those funds were distributed by the Kansas Department of Education.
That's great. I want documentation to show that. I don't want to take your word. I want to see documentation. That's all I'm asking for, documentation. I want to see it in writing.
No problem.
pretty
I
simple.
have it. Yeah, happy to. So the the other actions that are currently underway, just for your information, we're going to start a community engagement process. And so one of the things we're doing is we're currently setting up a Unified Government American Rescue Plan website. And so we're hoping to have that up by the end of next week. And it's already been written and submitted to My Sidewalk, and they're gonna be helping us with that. And of course, we're wanting to engage in this public engagement process because the president's order on advancing racial equity in support of underserved communities encourages all the ARPA recipients to do the community engagement effort. And so as a result, we're planning to do a public hearing on July 29th to seek community feedback on potential ARPA funding uses and, just to inform the public and to gain comments and ideas. So we're trying to get the word out about the public hearing, through social media and other venues. Ashley's going to be helping me with that. And UG staff is going to continue to reach out to our community organizations to ensure their participation. The other thing we're doing, as I mentioned before, we are standing up a grant management division. We've put out an RFP that's published tomorrow to solicit bids from consulting firms to assist with sort of what I call the non-local fiscal recovery funds. Not the direct aid that we're going to be talking about tonight, but more all of the other grant opportunities that are available through ARPA. And so they will be helping with the grant discovery, grant writing, and acting as a community liaison between organizations to provide collaboration. And then also the grant management division will be writing a grant policy and grant administration manual. So here we get to the heart of it. So there's a couple slides on Kansas City, Kansas, and another couple slides on Wyandotte County. And the reason that we're segregating the 87 million that you often have heard about is because each of the unique entities have different missions, and they also are separate recipients within the federal law. So we have to abide by the segregation of the funding because of their status as different recipients. So starting off with City of Kansas City, Kansas, we received one half of $55.4 million. The other half will come in May. And after reviewing all of the ARPA guidelines for doing the calculation for what they are calling revenue replacement, Kansas City, Kansas's revenue replacement amount is $26 million. And that's revenue lost for 2020 and for 2021 combined, just the 2 years. Now you can use that revenue replacement money for government services. It is very flexible. Basically, any uses that aren't eligible in the other categories are allowed under this category. Unfortunately, you can't use uses that are you can't use so you are allowed to use revenue replacement money for the other categories, but not the other way around. So. And then,
I
so
wanna
the other.
just jump in real quick as
Yeah.
we're going through this, because part of this is a decision-making mode as we go through this. And I want to make sure this component is fully understood. From the federal government's perspective, we need to designate according to the eligible buckets where we're going to spend this money. One of the buckets, as Kathleen's saying, is revenue replacement. The recommendation is to put as much as we can into revenue replacement, because then you completely control how you want to expend it from this point forward.
Yes.
Okay? It's not going anywhere. It's just, here it is, 55.4 million. You have so many categories you can spend it in. One is revenue replacement. You put it all over there. We send that notice to the federal government and say, we spent $26 million on revenue replacement. Now you can take and decide this year, next year, or never to spend it, however you want to do, it's totally in the control of the 11 at that point. So you'll see that from both the city and the county perspective. That's the direction we're recommending and strongly feel that's how we should do it.
Turn the camera off.
Kathleen, go ahead with the rest.
So you bet. Oh, I advanced too quickly here. Oh, thank you. Okay. So, all right. So the non-revenue replacement eligible uses are public health, negative economic impact, disproportionately impacted communities, premium pay, and wastewater, storm, and broadband. So because it's a city, wastewater and stormwater are included here. On the county side, it's not, just to point out, but we'll get to the county here in a minute. So if you dedicate all the 26 million in revenue replacement that I calculated, that leaves 29.4 million for these other non-revenue replacement categories. Do you all understand that? Okay. So the non-revenue replacement categories, within them, there's all these subcategories, right? So this is where basically the menu of items you can spend the $29.4 million. Public health, you can replace, this is physical plant changes to public facilities in order to respond to COVID. In other words, you can repair all the HVAC systems in our facilities. Other COVID expenses like communication, isolation, quarantine, payroll of public safety and other public sector that responded to COVID. In fact, the payroll going back to the beginning of the crisis is allowed to be spent or reimbursed through this provision. This is the only area where you can go all the way back to last year. Everything else is forward expending from May forward. Mental health and substance abuse services. And then under negative economic impacts, household assistance for food, rent, mortgage, utilities, cash transfers, internet access, and eviction intervention or prevention. There is provisions for job training assistance, for small business economic assistance, tourism to mitigate COVID, which is very specific. You can't spend, you can only pretty much spend money to assist hotels in revamping their facilities so that the air handling is meets with the health guidelines. Other economic assistance, and also assistance for hiring back public sector employees who were either laid off or just weren't hired or because of budget cuts. So the disproportionately impacted communities, of course, it's really important for this act. They stress it greatly how the low-income populations and people of color have been significantly impacted by the pandemic, and the disparities that existed prior to the pandemic have worsened. So in the memo that I have attached for all of you to take a look at, there is a lot of statistics about those disparities in our own community. As well as at the very end, a detailed listing of all the programs that are being suggested as immediate needs, which we'll talk about later. All right, so I encourage you to look at that memo so that you have a clear understanding of the composition of our community and the needs that are out there on the human services side. So those areas that you can spend money on in that for disproportionately impacted are educational assistance or workforce training, healthy childhood environments, housing support for unhoused persons, community, which includes the development of affordable housing for low-income populations, community health workers and benefit navigators. So there's a lot of benefits out there. They're very difficult to access because they're complicated, bureaucratic, with the state. In addition, there's a lot of language barriers. And so there's a lot of there's the opportunity to get cover some of those costs. And then community violence prevention. There's violence increased during the pandemic, and they're hoping that communities will invest in that to reduce or intervene in those areas. The other eligible uses include premium pay for unified government employees or grants to private sector employers who could then provide premium pay to their employees. Wastewater and stormwater, broadband, which here it's the city share. We would share broadband costs between the city and the county. And then just ARPA grant management support. So these are all the areas that are available, like a menu, for non-revenue replacement eligible costs categories. The pot for this over the 2-year period is $29 million. Okay. Now, what I'm going to show you on the next slide is what we've thought about, coming from the direction that I felt I heard from the commission on July 1st. What we want to do certainly is to at least identify what the most immediate needs right now are so that we can continue the fight against COVID and give our departments and nonprofit and community partners the resources they need to continue the fight for COVID. So the CARES Act allowed for us the resources to get through the first 5 or 6 months, but now we're at a point where we need additional resources to continue that fight. And so we have reached out to all our departments and identified the funding pots for what those immediate needs are. And so we're going to present those tonight here with you. You can see they're kind of in summary form here, but they're written up in detail in the memo that was provided to you. So if you have any questions on that, which unfortunately I didn't bring the memo with me, so I hope you have it. So first off, this is just on the Kansas City, Kansas side. There are some changes to physical plant changes in order to accommodate the facility so that it could respond to COVID. So some HVAC changes. There's the communication costs which are $500,000. We have funding for small business economic assistance, similar to the program that was initiated as part of the CARES Act last year. And there is some funding, $200,000 to assist hotels with their HVAC systems, and then some other economic support of $60,000. There's $60,000 for the institution of some childcare camps at the Parks and Recreation, and then about $263,000 for ARPA grant support. So not a lot of immediate needs on the Kansas City, Kansas side. Most of the needs certainly are over on the county side, which we'll get to here in a moment, because their mission is, to serve the human services needs of the county.
So
Okay.
I would just add to where Kathleen is on that these are items that we've identified that we need to take care of these things within the next few months. So that's where we push them up. There are all these categories, or many of these categories are things we'd like to see our money to go toward. These are just ones that are kind of in hand, that we can go out there and start spending the money on right away to make an impact on some of these changes that we know are in front of us. And on the county side, you'll see a lot more.
I don't remember.
Yeah, actually, there's a couple before, Jim. Before we move on, Commissioner Ramirez.
Thank you, Mr. Mayor. I am actually going to hold my questions until she comes to the next page where she has a questions section. So I'll just wait till then.
Commissioner Bynum.
I was just going to ask on this page, municipal court management software for 900,000. What is that? Very bottom.
I apologize, but the photo of the Zoom is down here and I can't see. So, so the last two items are actually coming out of revenue, the revenue replacement pot, because they don't qualify in the other areas. And that's why they're a little bit different color. Municipal court management software is the software that basically administers the municipal court administrative functions. And it is at its last leg, and I think you could probably add some more than, and it's a legacy system. It needs to be replaced. I think the vendor is no longer really supporting that version, and it's time to do a revamp. It is sort of in conjunction with some additional funding that I have elsewhere, which allows for the reopening of municipal court, which I think is actually in the part of that 142,000 above. Yeah, that's what it is. Yeah, the reopening
I'll
of
do it
municipal
for
court.
700,000.
What's that?
I'll do it for 700,000. I'm joking. It's a joke.
Commissioner Walters?
So we're hiring that consulting firm to assist us with the grant management. Yeah, yeah. And there is the acquisition of some grant discovery and grant management software.
And that's over a couple of years, right?
You know, we're only planning on having the consultant for a couple of years. Yeah.
Commissioner Townsend?
Thank you, Mayor. I'd like to go back, Ms. Financial, a couple of pages, back to page 3 where you have the Squares Commission comments. Are these just merely a listing, or is this meant to be in some hierarchy?
Oh, no, just a listing, not
listing.
hierarchy. Yeah.
Okay.
And I'm happy to hear more comments so we can add to it.
Page 6, the July 29th public hearing, is that a separate hearing, or is that going to be part of a regularly scheduled Board of Commissioner meeting?
It will be part of a regular board commission meeting.
Okay.
And Commissioner, it threw that date on there because, as you recall, we need to have adoption of our community development block grant program. So we have to have those hearings that night. So it seemed like that'd be a good one to do in conjunction with that commission meeting.
Okay. Well, you may already have this planned. I know that Ms. Financial mentioned community engagement with this. I would like to see, at least, this may already be in the works, all of the neighborhood groups. We make sure that they get notice, you know, of this. That may already be in the works. Okay.
Yeah, I am working with Livable Neighborhoods on their outreach. In addition, we're planning on maybe 3 or 4 Zoom meetings with all the community groups so that I can answer any questions.
Prior to or after July 29th?
Next month, too. It doesn't have to be before the 29th.
Okay. Well, yeah,
Yeah.
more questions may be spurred, you know, after the 29th. On page 7, this goes back to something that the administrator said with the replacement revenue. Do we have a commission have to say, we want to do 26 million replacement revenue, and then that would allow us to use it as we saw fit in the categories that appear on page 3?
That's right, yeah. I mean, you could use the revenue replacement money for the categories on that called non-revenue replacement eligible uses. You could, yes. And then you would not have any flexibility, or you wouldn't be able to use it on items that are not eligible under these. So it would strictly have to be these areas.
Okay, let me make sure I understand that. So again, with the revenue replacement, we could use those funds on items that are identified on page 3.
So page 3 is what is this what you're?
Right.
Well, these are just comments that you provided.
I understand,
Yeah.
but they're
Yeah.
going
Answer is
somewhere.
yes, Commissioner.
Yeah, okay,
So,
okay, got
yeah.
it.
Revenue replacement will be totally your decision as to where you want to expend that money.
Right.
Okay,
So let me give
once
you-
it's designated as revenue replacement fund.
From the
Okay.
federal, once you classify it that
Classify.
way, from the federal government's perspective, then we just take it over and it becomes part of our general fund.
Yeah.
Okay.
So, and so I'm just going to give you an example. I'm not making any kind of suggestion, but if you wanted to spend the whole 50 million on roads, you couldn't, because roads is not an eligible use. You could only spend the revenue replacement amount on roads, for example. Okay.
Okay, on page 9, maybe I want to go back to page 7. I'm lost as to where this 3.3 million came from. I see the
Okay.
29.4, where's this other 3.3?
Yeah, I was actually going to cover that in the following slide. So,
Okay, well, I think I'm caught up now with the,
okay.
it was moving real, pretty quickly, and I want to get in. Thank you.
So, right, so just to reorient everyone. So, City of Kansas City, Kansas is a recipient of, over a 2-year period, $55.38 million. We have, through our staff needs assessment, identified 3.3 million as immediate needs. The detail is provided in the memo that I provided you. And we've also done the calculation that over a 2-year period, the revenue replacement is $24.5 million. So that leaves 27.5 million, of which we can continue our discussion about in the future months, or as part of, future months, really. So doesn't have to be tonight or even next month, but we can continue the conversation. We can garner more information from our public through the engagement process and continue from there. So do you have any questions here at this point?
Commissioner Johnson.
Commissioner Harold Johnson, District 4. Kathleen, do you have any more slides beyond this one?
Well, then there's the county.
So there are more slides.
Yes, but this is just the city. Yes.
So there are more slides.
Yes.
So maybe
Yeah.
we don't want to have so many questions right now. How many more slides do you have?
Well, there's about 4 slides for the county, and then we're going to ask Ashley to come up and talk with you about the prioritization approach for this remaining balances amount.
About halfway.
So we're about halfway and we have executive session tonight. Okay.
Oh,
Just want you all to make sure we're all on the same page. All right, thank you.
I'm trying to talk as fast as I can.
Commissioner Ramirez.
Thank you, Mr. Mayor. I'll try and make my questions quick. What under where it says the negative economic impact, what is other economic support? That's of 60,000 total. What constitutes other economic support?
It's an after-school and summer camp recreation center space footprint analysis in order to get the state certification and bringing centers up to code and standards.
Okay. Maybe I should read the memo before asking these questions.
Well, you gave me the memo.
It's true. Okay. I believe on the next slide, the 27.53, is that the remaining amount that we will receive next year?
This one.
Yes, the KCK remaining balances, is that the amount that we'll receive next year?
Okay, so in this presentation, I'm not really asking you to think about the cash flow. So,
Okay.
we got half the 55 million in May, and we're going to get the other half next May. But,
So
it's the two.
Okay, all right, thank you.
Commissioner Walters.
Similar question. So we have 27.7 million now,
We were allocated that amount.
and we have it, right?
Well, we have roughly half of it.
We have half of the 27
We
million?
have half of $55 million.
Right, it's 27 million. We have that now.
Okay,
And 26 million you gave us as the revenue replacement, and 29 million is non-revenue replacements. So
Yeah.
my question is, how much of the 27 million that we have received can we spend right now? Do we have to worry about part of it being categorized as revenue replacement and part of it being categorized as non-revenue replacement?
so this presentation combines the 2 years together and does not account for the cash flow and whether we received it or not, okay? And so frankly, we can proceed along those lines, or we can decide as a commission that you would like to treat all of this allocation as a tranche number 1 and tranche number 2. For simplicity's sake, I presented it all in a lump sum together. Okay? So,
I know that. So I was asking how much we could spend right now. And do we have to worry about it
Right.
being in the 26 million of revenue replacement and the 29 million of non-revenue replacement?
well, so we can obligate the funds, right? And in the current, we could obligate the entire amount, and we would figure out the cash flow situation ourselves internally.
Can I ask your question in a different way?
I think I need some help.
Okay, so when we got our half, that we already have in our checking account, did the government tell us that we have to treat that half as all revenue replacement or all
No,
not? Okay,
no,
so we get to decide whether this first tranche is all revenue replacement or whether we use the second amount as revenue replacement.
yes, you could.
Does that answer your question?
Sounds like we can spend it all right now if we wanted to.
Yeah, and
Because I don't remember any commissioner saying, I think we should put it in the bank and earn interest.
I think Commissioner Burrows just said that.
Oh, he did? But he's not here. Thank you.
Commissioner Markley?
Lord, what I was gonna ask. Oh, yes, I do. So I was just gonna say, I know you're kind of giving us what you've got as you've got it, and we're kind of working through this, but you know those little one sheets that we get in our budget notebook that tell sort of what the expenditure is about, what department it came from, how many staff are gonna be allocated to it. You know what I'm talking about? The little one
For
pages?
each department.
Yes, I would love to get something similar for the recommended expenditures that we're looking at here. So
Okay,
your one-liners in the memo are good. I looked those over, that's nice, but I'd like a little more detail. So sort of one-page format where it says, this is the department that recommended it, this is how much it's gonna cost, this is, who's gonna handle it, or what staff members we're gonna hire. Just that sort of information would be helpful. Again, I know you're giving us what you've got as you've got it, but longer term, I'd like to see that.
oh no, we have all that, actually. We just didn't want to overwhelm you with detail.
Well, I'd like to see some of that.
All right, thank you. Let's move forward.
All right, so same drill, only we're talking about Kansas City's, or Wyandotte County's funding requirement. So Wyandotte County is a recipient of $32 million. 16 of it we got last month, or in May, and 16 million of it we'll get next May. The revenue replacement for Wyandotte County is lower because it's very reliant on property tax. And for 20 and 21, property tax was not really affected by COVID. So it is roughly $11 million. Split up 6.6 in 2020 and 5.3 in 2021. This, by the way, this calculation is a little higher than what I presented in previous recommendations or presentations because I did some refinement of the replacement. The guidelines had some direction that I missed the first time. So we have more revenue replacement on the county side with this presentation now. You could use it for all government services. Again, it's very flexible. The uses, so any uses that are not in those other categories, right? You can spend this money on that. right? Although you can spend this money on those other uses as well. When you're off strike. Okay, so that's the pot. 11 million out of the 32 is revenue replacement. The remainder amount is $22 million, which has to be only spent on these 5 areas. You notice that stormwater and wastewater are no longer listed because stormwater and wastewater are not county functions, it's a city function, right? So this is the same eligible uses, except there's a few additional ones because a lot of public health needs are listed here that are not addressed on the city side. Vaccination, testing, contact tracing, prevention in congregate settings. So all the others are the same. Oh, one of them is aid to nonprofits to mitigate COVID. That's a new one introduced on the county side. And oh, and then the other over here is other units of government in the region. That is a county function. So the immediate needs on the county side total $8.44 million. 5 million of it is for public health. We work very closely with the UG Public Health Department to determine their needs for the next 6 months, or 6 or 7 months, or maybe 10, around that. So, you know, in order to get us out of this pandemic and back to a more healthy and sustainable future for our residents. So 1.7 million for vaccination, testing, and contact tracing. Keep in mind one thing, we will continue to apply for FEMA reimbursement. If we do receive FEMA reimbursement, we will credit the costs related to the reimbursement, which may be reflected here, to the FEMA grant and not to this money. So there's still a shifting and a careful management of the grant in order to optimize the funds that we got. So right now, this is assuming that we're not going to get FEMA reimbursement at all for any of these, but that probably won't be the case because the FEMA reimbursement process is extended all the way through. They're reimbursing 100% through December. So there's some funding for prevention in congregate settings. There's communications dollars of roughly 500,000 for to continue to outreach to our communities about the need for vaccination. There is $1 million in funding our public health staffing. Right now, many of those staff members are assigned to specific state grants, and so they can't they can't do work that isn't related to that state grant and continue to get paid. So this would allow for more flexibility so that we have more resources in terms of human capital to address the public health crisis because we have a funding source to pay for their salaries. So it doesn't necessarily add FTE, it just allows for more funding flexibility. There's mental health, substance abuse, a public health department mobile clinic unit, and demobilization and storage of the current vaccination site, which we've been estimating will cost $600,000, and then some other $800,000 in other public health services costs, all of which are listed in detail in that memo I provided. And by the way, the Department of Public Health, Wesley is on, and I think Julianne Stanley is on the line if you want to talk with her or ask any questions. The negative impact at total $1.2 million, 618,000 of it is for housing assistance for food, rent, mortgage, utilities, internet, and prevention, etc. All of which is listed here. The largest one is 200,000 for the direct food assistance via deployment of the DOT mobile grocer. Some others that are larger are to provide legal assistance for those that are where their landlord is trying to displace them. So other assistance such as that, there is 80,000 for job training assistance, which is in collaboration with Wyandotte. We have allocated $500,000 in aid to nonprofits to mitigate COVID. So although there have been many nonprofits that have benefited from the CARES Act in their ability to provide assistance to our disproportionate communities, the low income and people of color, and those that are underserved in terms of healthcare. They have all benefited from CARES Act, but that money has run out and there's still a lot of needs. Now, one thing that we do want to point out is when we provide funding to these nonprofits, however the allocation process turns out, of course, we're open to your suggestions. These amounts that go to the nonprofits absolutely have to be projects that align with these restricted eligible uses. They can't just be, we're cutting checks. So just so you know, so it will be administratively burdensome, but we're willing to make that effort if that's your direction. Okay, so that's what we have here. 500,000 is just a number we came up with. It really isn't. There isn't any rationale behind it necessarily. It's just an amount that we came up with. So the other thing, $250,000 in educational assistance is for technical skills education to previously incarcerated offenders seeking to pursue new business opportunities. So we're hoping to partner with the community college and other nonprofits that are looking to do that work. There's 160,000 in housing support for unhoused persons. Of 160,000, that is the CHIP housing backbone support for new lead agency. There's community health workers or benefit navigators who will assist with developmental disabilities and human services, as well as aid to provide assistance in getting utility bill assistance from the state of Kansas. And then there is 500,000 in community violence prevention. There are 6 programs underneath that for that effort. And the largest one being the expansion of the Unified Government's Public Health Department Violence Prevention Programs and Services in general for $254,000. So many of these programs can be, well, I have the health department on the line, so they have a lot of these programs. Now, under other eligible uses, we don't have any premium pay built into the immediate needs at the moment, and that's because, we can still pursue and talk about those subsequent to tonight's meeting. So it's not that we just felt that it was something that we wanted. We wanted to immediately meet the needs of our residents and then talk about the premium pay for employees separately. So it's not like we're not recommending it, just not now. And then the last one down here is online processes and implementation to expand remote customer service experiences of 500,000, which is coming from out of the revenue replacement pot. So that's how we came up with the $8,044,000. So in total, Wyandotte County, to give a tally, so you're getting $32 million over the 2-year period. We have $8.4 million in needs. We've identified $10.4 million as revenue replacement. And so that leaves on the county side, $13.2 million to talk about for future discussions. Now, so at this point now, we want to engage in a prioritization beyond the immediate needs. And at this point, I was hoping we could have Ashley join us.
Right,
I
there are a
will
couple.
probably jump in here, Mayor, and just
Yeah.
ask the question. I know it's 7:30 at this point, so, and we are recommending a public hearing next week. So this is an exercise we had prepared ourselves to be able to work with you, but not really knowing how long it would take tonight to get to this time. So we're certainly good to do it tonight if you'd like to. Our executive session will take an hour. But if you'd like to do this now, or we can push this to a future date after you've had other input.
I'm gonna recommend we push this to a future date because we've got to have the energy to go to complete this. So
I
Commissioner,
think having time to look over the materials
Yeah.
and the memo would be helpful as well.
And that's what I was just going to ask. This is a lot of material, and it takes a while to wrap your brain around it. I would really appreciate and believe I could be a better participant in these meetings if I could get these materials and these data ahead of the meeting. Even if I don't fully understand what I'm looking at yet, at least I'm starting to frame reflective questions that will help me discern what it is I'm looking at. I don't like to come into a meeting like this and be expected to participate in a discussion or expected to make a decision when I don't have a firm grasp of the fundamentals on which I'm supposed to discuss or decide. Please find a way to get us these materials ahead of the meeting so that we can at least look at them and start to frame our thoughts and questions to make these meetings more productive. Thank you.
Commissioner Ramirez.
Thank you, Mr. Mayor. And second, everything that Commissioner McKiernan said, 100%. You, Kathleen, you brought it up very quickly, and so I just want to make sure I have my line of thinking correct. When you mentioned about the premium pay for employees, it's not part of the immediate needs, but it's something we can allocate with the remaining 27 from the city and the 13 from the county, correct?
Yeah, well, premium pay is an eligible use. And frankly, if you want to make it an immediate need, all you have to do is add it in. You
Okay.
tell us.
Okay. I would see now that changes. Going along with Commissioner McKiernan is a lot of information to digest and have to understand. So thank you.
Commissioner Philbrook.
Thank you, commissioners, for saying exactly what my poor little brain was thinking. And that is that I love to participate in these conversations, but I have to chew this over and over again and think about this, how one thing affects another before I can even come close to making a recommendation on any of this. If we want to do things like this and have a presentation, that's wonderful. But then you need to just plan on that being the presentation and maybe asking some questions and planning on a future date for us to talk about it with you. Please, I don't mind having the presentation, but I don't want to be expected to give a decision on something I haven't had a chance to study. And I know you guys have studied it over and over again, or you wouldn't have been able to give it to us.
Yeah.
And I appreciate that.
Commissioner Bynum.
No expectation, actually. We're just presenting the information. Yeah.
I have a question. If I understand what you're putting in front of us on July 29 and possibly at additional dates beyond that, we're going to have the public, the community participate with us in prioritization or idea sharing about the spending of the money?
We're going to give the public an opportunity for them to share their ideas and their thoughts about what they find is important, so that you can take that in.
About how to
as you
spend
make
this
your
money?
The whole $87 million
Okay.
pot.
Budget public hearing, but for this.
Well, the reason I'm asking that question is because how will we present the uses of the money, the allowable uses of the county side and the city side, in a way that our general public's going to understand? I'm working on understanding everything you've given us tonight and I'm struggling. I'm worried that we're going to have the community come forward and say, we need a kayaking lake. And we're going to say, well, we can't do that. And then they're going to say, well, typical.
Well, that would be under revenue replacement. You could actually pay for a kayaking.
All
Yeah.
right.
Yeah, I'm just saying.
I'm concerned and I want the public input, but I'm hoping that we are able to do something very simple
Okay. Yeah.
for them ahead of time that says, here's your buckets of how you can spend the money. It concerns me that we're going to disappoint our community by having them tell us what they think is important and having us go, sorry. So,
And Commissioner, we don't have to do the public hearing next week if we feel like that's too soon in the process. I think a similar early presentation showing the eligible buckets for non-revenue replacement money is one thing to show out there for the public. Otherwise, I mean, the non-revenue replacement is wide open and people could come in and tell you a kayaking lake or whatever for your consideration. And that was our intent in getting this out to you tonight, that, you know, we can take it as far as you want to, as far as working through it to understand what you can spend it on, what you can't spend it on. And your decision making to this is you've got a couple of years. So we're not putting in front of you tonight going, you need to decide. We're putting in front of you tonight so you can start to understand it. If we don't dig into it a little bit more, it's hard to start to understand it. You know, as we've looked at it and then started to break it out, it still becomes something that's hard to get a hold of. So this is that first opportunity to get it out there and show you, you know, I think that's what we thought the easiest ways to start breaking it out. We're going, here's your 3 buckets, you know, revenue replacement. That's a pretty easy one to understand. And then you can take that and work with it. Immediate needs, what's our staff telling us? Here's things that need to happen now. And then what are your defined categories that you have left to spend it in? And then you can take that back and you can work on it now for the next few weeks to months to whatever kind of time frame you want to put to it. We threw the public hearing in there based on what came out in the president's message around it, saying, okay, like we do in the budget process, in February, we have a public hearing for people to come in. They've been hearing about it for a while, so they'll come in and give you some great ideas, you know, that you can consider as you think about all these different categories.
I want the public hearing. I just want us to be prepped with material that can be shared with the public about as simply as we can possibly make it.
Yeah, I plan to put that sort of information on the website,
Okay.
but
Sorry, Mr. Mayor, agree with Commissioner Biden trying to make it more, because even I, sitting through this presentation, it seems, and I'm still trying to figure out, like, some funds can be spent on these type of categories, but the funds used for this category can be used for this. And I'm trying to still myself figure out what can be used where. And so when we have the public hearing, if we can have that simplified a little bit for the community of understanding, because even with, I don't even think simplified is a real word. Apologize. It's been a long night. But even like I said, going through this presentation for us, I'm still having trouble figuring out what money can go where and how can it be spent. And if I'm going to have trouble, I know the community is going to have trouble with that as well. And then if there's still that confusion, then we're not being open with them when we're doing the public hearing and how we're explaining everything works. Because Lord knows ARPA was a extremely big, huge bill.
Uh-huh.
And, staff is doing the best they can to bring all of the information into simple terms, but even then it's hard then.
yeah.
And so I just asked that to make sure that when we do the public hearing, that you just more, not, I don't want to say more simple, but more using common terms that the community can understand. Because like I said, the connections with everything, I'm still having trouble. Thank you.
Commissioner Townsend?
This point of clarification, going to this timing thing, is the expectation that these decisions be made so they would be executed in concert with our budget? Or it's not necessary that that timing be on the same exact track?
It's not necessary that they happen at the same time. Can happen independent. Some of these things that we do have that have come in, particularly some of them for public health, probably have a little bit more of an urgent side of them than some of the others. And I think those are some of the things we can maybe underline as we come back and look for decisions on it. We tried to break out immediate needs versus others, thinking, I'm honestly like small businesses. That's not I don't have an immediate need, but it's also one of those that we thought, from your perspective, if we could get another grant program going now, businesses need the money now, not next year. If they're truly in a need for it. So that's why we classified it like that. But I'm not setting on something ready to write a check to somebody as soon as, we walk out that would work for us. So.
Well, that helps me to understand that then, because I wouldn't want to deny any of these organizations or anyone who might be a recipient, but that also gives me the impression and the idea that what we do with this money is not going to be a plus or minus to the budget. Is that correct? That would be a way to look at it?
Well, I'd probably say the non-revenue has an opportunity to be a plus to what we do to the budget, because there are some opportunities, particularly on your one-time spent cost, of things we want to address.
Okay.
I see Julianne Van Loo, our Public Health Director, has her hand up. Julianne, did you have something to address?
Thank you, Mr. Mayor. Yeah, I just wanted one moment to help Commission understand the urgency for the health department's immediate needs. It's not just that we have to continue our COVID operations, it's that I'm really hamstrung and can't launch a number of new COVID-related initiatives. There are a host of temporary staff I have to hire and hire soon, but I can't even start that process because I don't have enough funding. So I have about $1 million to get me through the next few months to keep Kmart going, to keep my mobile team going, but I can't bring on the grant writer that's causing us to leave millions in federal dollars behind. I can't bring on my new epidemiologist because it's unlikely that FEMA would reimburse that position. I can't bring on my development manager. I really am stuck on a number of COVID fronts until I can get access to this ARPA funding. So I just want to make sure Commission understands that we have a very urgent need. I fully support taking our time with the remainder of the cash, but I am going to have a cash flow issue here sooner than later. And I need to be able to bring on some additional staff as our COVID numbers, unfortunately, are spiking once again. And we're having to regrow our testing team, regrow our contact tracing team. So we have some real urgency and immediate needs in public health.
Yes, Julianne, what would be the timeline?
I mean, really what I'm stuck with is not knowing. And so if I can even know in the next couple of weeks, if I'm going to get a nod at this $5 million, then at least I can plan. I can start working with human resources to post those positions. I can start putting programs into place, at least at a planning level. So, I probably need the money within the next couple of months, but I need the nod more than anything to allow me to start to move on some of this work.
Yeah,
I think within the additional information we share with you, we can show some of them to where here's something, I need a decision on it now versus later, as we didn't bring any of it to say, decide tonight. But that's why you have this to look at, you can contemplate it. And then as we come back on each of these, as we're planning, we can highlight ones like Julianne has that are ready to go. Or some of the other, and there'll be some of the others the same way.
okay. So this comes back on the 29th, correct, with the public engagement of Commissioner Philbrook?
So they aren't here, but I want that back. You took it away from me. That page that had the ones that were darkened in. One of them was the housing assistance and the other was homeless. And I will tell you that both of those, the housing support and the household assistance, are in immediate need now because the COVID money has run out and they are begging, borrowing from private sector as much as possible to get funding to keep these people in their homes. And it costs 10 times as much to put them back in a home as it does to keep them in a home. And I'm tell you, this is an immediate need. Thank you.
Okay, I think that we'll now go into executive session. Oh,
Can
Commissioner.
I just ask one thing? Staff have identified at least, and fellow commissioners have identified at least a couple of priorities. And so as we're originally going through this, we're not pointing out priorities, we're just laying the tableau that we can play on. I would really like to know, as Ms. Van Loo just pointed out, as Commissioner Philbrook pointed out, if we believe in the consensus among staff that there are absolute priorities that the commission should consider, I want to know those so that I can advocate for priorities that our staff believe are critical to our short-term operations and setting up long-term success.
Commissioner, the immediate needs we've highlighted tonight are the ones we've come up to say we think these are ones that you should be looking at for funding now. That's why we highlighted them that way.
Okay, but I guess the question is, how do we give consent to move forward on those immediate needs?
Well, that's where we'll come back. I mean, as you said earlier tonight, you don't want us to give any information. We wanted to present it to you so you'd understand it, have time to work through it, and then we can come back in our next workshop. And if we get the direction to go that way, then we can put that forward to the commission for a vote, I guess, and say, this is how we want to spend that money. And we
Yes,
can take it in chunks. We don't have
Ideally,
to
I would
take
like
in-
all of this ahead of time. 2 weeks ago would have been good to have this, or a week ago, 3 days ago, yesterday would have been good to have this information so we could thoughtfully consider it. But now we hear that there is an urgency to at least one of the items on this list. Yes, you pointed out all the priorities here, but now urgent is a little bit more important than simply a priority. At least that's how I'm interpreting it. So I didn't get that nuance as we went through the original data until we had this comment here at the end. So.
Commissioner Bynum.
With regard to Commissioner Philbrook's comment on the slide with the priorities, and one of them was highlighting the housing and rent. We have the KERA program. Kathleen and I have been sort of emailing back and forth a little bit about what can the unified government do? In what way can the unified government be helpful to the KERA program at the state level, which is the program that the landlords and the tenants must apply to in order to have rent and utility relief assistance. And we're watching the Board of Public Utilities have this conversation as well, because folks are appearing at their board meeting to say, please, you cannot shut off people's utilities in July. And everyone's pointing folks to KERA. And yet KERA seems to be working very, very slowly. And my point is, there is a fund established that's in place through the end of the year. And while I would love to have an urgency about using some of these funds toward that, there's a fund in place. What I would like is, how can we facilitate in any way possible making it actually work? I think what's happening is it's not working.
Yeah, and from what I understand, the KERA, it's really on the state side.
Right. It's
And-
entirely on the state.
But I'm not sure there's anything much we can do about that on the state side, as much as we've appealed to them. And
Have we appealed to them?
Well, we've made calls from our office for sure.
To the state for that
Oh,
program?
absolutely.
Because I know the BPU is asking them.
Yeah.
And we're asking them.
And some of the applications have been processed, but not enough.
Anyway, okay.
The issue also around that is it's so complicated even to apply in some ways that there's been a lot of people who have had to find other folks that supply these wraparound services like Avenue of Life to help them apply. And so, not everybody has the capability of doing this stuff like we do. And so I will say, we could always help with that if we wanted to. That would be a way, for the application. But that costs more money, for us to pay for people to do this. So I'm just saying.
All right. One more. Commissioner Ramirez.
Yes, last comment of the night on this. Kind of going off of what Commissioner McKiernan, these are immediate needs, but it seems that some may be urgent. So I would like to see us next time when we come back to this discussion of telling us what of these immediate needs, what needs to be done now. Because they're not immediate now, they're urgent. Coming from what Julianne said from our health department, I would like that of what of these immediate needs to be done now.
So all of the individual projects are listed in the memo I provided you in the back of the memo. Yeah, so you can review that. And, but I can say that all of them are immediately needed, except perhaps we can hold off on the 500,000 we have dedicated roughly for business assistance. That could probably be delayed. The 500,000 that we have worked in for online implementation of online processes. Some of those items, if you go through the list, you probably can see which ones probably could be put off a month or two.
Okay. All right. So this time the commission will go into executive session for consultation with legal counsel regarding litigation and labor. We have a motion for executive session.
I move that the commission go into executive session until 8:50 PM to consult with our attorney and to discuss confidential matters relating to pending litigation and matters relating to employer-employee negotiations regarding the status and future direction of labor negotiations as permitted under the Kansas Open Meetings Act, and that staff designated by the county administrator be present to participate in the discussion.
Second.
We have a motion and second. Roll call, please.
Roll call. Townsend,
Aye.
McKiernan,
Aye.
Ramirez,
Aye.
Johnson,
Aye.
Kane, Markley,
Aye.
Walters, Philbrook, Bynum,
Aye.
Burrows is absent. Albee.
Aye. Thank you. That motion is approved. We are now moving into executive session.
Commissioners, I'd like at this time for you to please log out of Zoom so that our executive session is kept confidential.